To do one living donor liver transplant in one facility is enough. But to do 3 living donor liver transplants in the same day in one facility, that requires a lot of resources and expertise. The biggest challenge in organ transplant as well as in liver transplant is really the organ availability. And a living donor transplant is one of the approach that we've been trying to expand here at the New-York-Presbyterian, Columbia. This procedure, the first Domino liver transplant done through the living donor and is split into 2 adult recipients. So those 3 elements are done at the same time. That's very unique about this surgery. This was done from the altruistic living donor. The recipient of this altruistic living donor has a specific disease called MSUD, maple syrup urine disease. MSUD is an enzyme deficiency. The patient liver missing the enzyme can be transplanted to other people without MSUD. So most of the Domino done in the past were given to another child. That was the most common Domino procedure in MSUD patient. However, this patient was already adult and the liver was large enough that can be even split into 2 adults. It's relatively easy to split into a small section and large section. To do it right in the middle, to split into 2, is a much more complex procedure. So first patient was the donor, second patient was MSUD patient, then third and fourth patient went into the room while we are doing the surgery, because as soon as we split the liver of the MSUD patient, the liver recipient has to be ready to also receive the graft. So this procedure involves over 12 surgeons, more than 15 hours, and 4 operating rooms. New-York-Presbyterian Columbia Hospital has a lot of different subspecialty doing surgeries. This process planning really included not only surgeons, but the dietitian, geneticist, and then hepatology, and then medical specialist. This procedure is only possible with this type of environment. New-York-Presbyterian Columbia really fosters innovation and also the thinking always to put the patient first. So the impact of this procedure in the future of transplant, this sort of a continuous effort to make more organ available to patient and more patient to be helped by the liver transplant, I think that's a really important endeavor. I'm so happy that we are able to give patients a second chance and give the opportunity to live the life to the fullest.